Pediatricians are concerned about some possible changes coming for childhood vaccines.
We've got Dr. Molly O'Shea in studio today to explain. Doctors, this linked, it's pretty much made at the federal level. So I think it's important for context.
Yeah.
You've been doing this a long time. I'm sure you've seen this happen before. Kind of what does it take to get to this kind of moment when there's going to be a big decision made?
Well, the ACIP informs the CDC which vaccines they recommend, and then the CDC basically follows their lead. And up until now, the ACIP has been this amazing group of superheroes, right? It's this committee, they've got epidemiologists and infectious disease people and pediatricians. And frankly, it's been this behind the scenes group that we have not really had to think twice about. And we can rely on the information. It is something that I've used every day of my professional life in order to guide families in making decisions about vaccines. They were swept away, right, and replaced. They originally with 8, we're now down to 7. One of them backed out after having to fill out his conflict of interest form. And the people that have replaced them have a very cynical or skeptical thought process about vaccinations. So now, as they're considering, today they're considering the RSV vaccine stuff for infants and for moms. And then they are also forming working groups around hepatitis B vaccination in the newborns. They're also going to be looking at any vaccine that's been approved for more than 7 years. We're very concerned that the recommendations that they come up with will not necessarily be looking at the evidence in the same ways it's been looked at before.
And, Dr. Molly, you mentioned being concerned. What troubles you most about this?
Yeah. What troubles me most is that because of the way in which RFK Jr., the current Secretary of HHS, has demonstrated his difficulty in looking at scientific data with clarity, being able to throw out bad science, keep good science, I'm concerned that the information they're going to use won't necessarily be top-notch, and that they aren't necessarily going to have a public health view, considering the idea that we need to keep all people safe and healthy. We need to have access and choice available for everyone, because these decisions affect whether insurance companies pay for vaccines, whether people with Medicaid or no insurance have access to vaccines too.
I think it's important too. I mean, what about parents? I mean, it's their child that's going to essentially see these recommendations. Any say from them, or is it really just those 7 people that are making, plus maybe RFK Jr. who makes that decision?
It's just them. And so what makes or breaks the decision is, as far as insurance payment goes, in the past has been them. Insurers may ultimately decide to have a more liberal acceptance of paying for vaccines just because they want to keep people healthy. And the American Academy of Pediatrics has decided we've always published our own vaccine schedule for over a century now. In the past, it's always been in alignment with the ACIP. It may no longer be. We don't know. So parents will have alternative guidance if there isn't a matchup.
And before we let you go, I mean, when would these changes take effect? Is this coming in months?
For the fall.
Okay.
Yeah,
so
very soon.
Going to be here before you know it.
Yeah.
And I'm sure this isn't the last we've heard of it either. We're just kind of.
It's going to be an ongoing controversy, I'm sure.